Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist I have provided almost all the topics in a very systematic fashion so that it is quite convenient for the study. You can also make use of it. Thank you very much. My dear friends, we were discussing about fever. Basics we have seen, then case studies also we have seen. Now we are doing the clinical evaluation. In the first class related to clinical evaluation, I have seen the 4 things that you have to see, 2 things that you have to ask and 2 things that you have to see. 2 things that you have to ask is behavior of the child and as well as urine output. 2 things that you have to see is respiratory rate and as well as cardiac rate, heart rate. Now, suppose if the child is not serious, in the sense all these 4 parameters are okay, there is no problem, then you have to look for the localization of the bacterial infection at the site of the entry. Okay, so at the site of the entry, you have to look into the localization of the infection. Now, localization of a bacterial infection can take place at any site. Viral infection, it is quite easy to identify. We know that. Viral infection comes with the multiple symptoms, cough, cold, nasal blockage, rhinorrhea, many problems will be there at once. And it is of sudden onset. Interfebrile period is normal. Okay, rhythm is very short. And fever comes down as the day progresses. And there is a lot of associated symptoms will be there. But as far as the bacterial fever is concerned, so localization is very important for the diagnosis. If the only fever is coming and localization is not taking place, then it is very difficult to diagnose the bacterial fever. Okay, so we should wait for the localization. Now suppose a fever is coming now the 3rd day. Usually by 3rd day or 4th day the localization starts in case of bacterial fever. Usually in general we can say, assume that by 3 or 4 day the localization starts. The localization may take place in the lungs. If the localization of the bacterial infection takes place in the lung, it leads to bacterial pneumonia. The localization may also take place in the meninges, then it leads to meningitis. Localization usually takes place on the 5th and 7th day, usually for the typhoid fever and as well as Kawasaki fever. Kawasaki is immunological fever. Usually the localization takes place such a long time, see 8 to 14 days. Sometime in partially treated infections, when the infections are partially treated, improper unwanted antibiotics are given and that misdirects the normal process of evaluation of the evolution of the fever. So that may lead to this problem. But if the fever is persisting and then no particular localization takes place even after 14th day or thereafter also, then we have to think about 2 important things. One is tuberculosis and another one is malignancy. So this is one important part related to the clinical evolution when the patient is not serious, and if the days are gone increasing without any localization, then the chance of severe disease will go on increase. Now see, always acute fever is always not dangerous. Mild fever is always dangerous. Tuberculosis will have mild fever. Malignancy will have mild fever. And most of the bacterial infections, they start with a mild fever. Okay. The fever which suddenly started is not much dangerous. So mild fever which is coming daily, that is more dangerous than a very severe fever which is persisting for 2 or 3 days. Okay. So with this I conclude. From the next class onwards, we will discuss another important thing related to tuberculosis, fever in tuberculosis, which is quite interesting. Thank you very much.